Now, I will go again to the different statistical tests just to highlight what are the statistical tests you are most frequently going to encounter. There are different types of hypotheses according to what I just showed you. The different types of hypotheses are the following. I'll give you 3 scenarios. The first one is according to the following. This is an intensive versus conventional insulin therapy. It is a randomized controlled trial in medical and surgical critically ill patients. It was a study that we carried out in the National Guard in the ICU department. Now, what I care about is this. The first scenario for a statistical test is the following. I want to compare the gender distribution between insulin, intensive insulin, and conventional insulin. Now, I have a p-value here. It was 0.82. What does it mean? Is there a significant association between gender and the therapy or not? 0.82 is above 0.05, meaning there is no significant association. What's the hypothesis? The hypothesis is saying that the proportion of females in the intensive is equal to the proportion of females in the conventional. The alternative, the proportion is not equal to the proportion, or there is an association. So what do I find? I find a p-value of 0.82. I calculate it by a chi-square. So a chi-square is a statistical test that I use when I have 2 variables. One is categorical and another one is categorical. You remember we said all the analyses are decided upon by the types of variables. So if I have 2 variables, both of them are categorical, then I do a chi-square test. Now, another example, if I want to do the association between age and the insulin therapy, this age is continuous and this is categorical. So basically I have 2 variables, one is categorical, one is continuous. I will not be able to do a chi-square. What I will do is something called a t-test. What do I find? Is 0.05. 0.05 is at the border, and I consider it with the support for the alternative, and thus I will say there is a significant association between age and intensive insulin therapy. So 2 scenarios so far. One is categorical, I do a chi-square. Another scenario, categorical, continuous, I do a test called t-test. The third scenario is if I have a continuous variable and a categorical, but the categorical has 1, 2, and 3 groups. So it has 3 groups, not like the previous one. The previous one, it was continuous, but 1, 2 groups. So in this case, I cannot do a chi-square, I cannot do a t-test, I do something called an ANOVA. ANOVA is a test that we do to calculate the p-value for a scenario when you have categorical, 3 levels, and the continuous variable. And finally, I found a 0.02 p-value, meaning that it supports the alternative, saying that there is a significant association between age and the tertile of the caloric intake. Now, in terms of data analysis, we have the univariate analysis, we have the bivariate analysis, and we have the multivariate analysis. The univariate analysis is when I'm analyzing only one variable at a time. So when I'm summarizing the percentage, when I'm doing the average and so on, this is univariate. Bivariate is done when I want to do 2 variables, like the ones that I just gave you, age and mortality, hydrocortisone and mortality, and so on. So I'm combining 2 variables together, and I call it bivariate analysis. Before I go into the multivariate analysis, I would like to highlight the bivariate analysis. This is the selection of the statistical test. For instance, you remember when we said that we call it either exposure or independent variable or the risk factor. The outcome is dependent variable. Assume I have 2 levels and 2 levels. So for instance, I do a randomized clinical trial drug A, drug B, and the outcome is mortality, yes, no, I do a chi-square test. If I have the intervention, drug A, drug B, and the outcome is, let's say, trauma level 1, 2, 3, 4, or 5, triage level, I also do chi-square. So if I have more than 2 levels here, but 2 levels there, for instance, I might have 3-arm clinical trial. What does a 3-arm clinical trial mean? It means arm A, B, or C. So I have 3 levels of the drug, and the 2 levels outcome like mortality, I do a chi-square also. And if it's more than 2 levels and more than 2 levels, I also do a chi-square. Now, when I have one continuous variable and one categorical variable, 2 levels, I do a t-test. And we just went over that. When I have a continuous but more than 2 levels, I do ANOVA. The same thing here. If I have 2 levels and continuous, I have t-test. When more than 2 levels and continuous, I do ANOVA. So basically, the most frequently used statistical tests are chi-square, t-test, and ANOVA. And knowing these 3 tests would summarize for you almost any statistical analysis you would do. But finally, if I have continuous and continuous, I have a test called correlation. Now, multivariate analysis, why do I do multivariate analysis? To control for confounding. Basically, I have confounding could be controlled by, number 1 is randomization. What is randomization? We have talked about it, where we create 2 groups who have equal characteristics, right? But most of the times I cannot do randomization because it's unethical or so on and so forth. So I cannot do randomization. I can do restriction. What does restriction means? I do not take everybody. I take a group of people. For instance, you remember the example about coffee and lung cancer. So I have coffee drinking and the outcome is lung cancer. So smoking is the confounder. Why? Because it's associated with coffee and with lung cancer. So smoking, when I want to control for it by restriction, I say I do not want to take any smokers. I restrict my study only among non-smokers. So I control for the effect of confounding. But I might have maybe 5 or 6 or 10 different confounders. I cannot keep on restricting because otherwise I will end up with very few people. So I do matching. What does matching mean? Matching is mainly done in case control studies. What it means that if I take a coffee drinker who is a smoker, I take a non-coffee drinker who is also a smoker. So I'm imposing the equilibrium or the balance between the 2 groups. So eventually, smoking will be evenly or equally distributed between coffee drinkers and non-coffee drinkers. But again, it's hard to implement. Stratification is when I'm analyzing my data. If I'm analyzing my data, I do not consider everybody together, coffee and lung cancer. I stratify them. In other words, I take smokers alone, non-smokers alone, and I do my analysis. And eventually, I will be controlling for confounding. But the most important way of controlling for confounding is by the multivariate analysis. What does multivariate analysis mean? Multivariate analysis is when I take coffee and its effect on lung cancer. This is bivariate. But when I talk about multivariate, there is a certain statistical technique where I tell the computer, I want to control for age, and I want to control for gender. I want to control for smoking. I want to control for family history of disease, and so on. So what I'm asking the computer in a certain very specific statistical analysis, I ask the computer to give me the effect of coffee on lung cancer, but when removing the confounding effect of all the other variables. So the smoking, the family history, and so on and so forth, and you can include other variables as well. So the multivariate analysis is the most effective and the best way to control for confounding. Basically, we have 2 types of multivariate analysis. One is called logistic regression, and one is called linear regression. So if you are reading the statistical analysis section in a paper, you might come across logistic regression or linear regression. Logistic regression is used when you have the outcome being two levels, like mortality, yes, no. Hypertension, yes, no. But when you have the outcome being continuous, like the systolic blood pressure, for example, you do linear regression.